There is a question about the symptoms, doctor, of COVID-19. They said there is some evidence or some new studies that the symptoms now, including abdominal pain, and sometimes they said renal, or sometimes it will affect not only the lung, it will affect the heart. Is there any evidence for that, or it's just the respiratory symptoms?
It's really a very nice question and very pertinent question to the COVID-19. It is an evolving infection, basically, COVID-19. That was the reason in my presentation I said whatever the available data was available up till now, my presentation was based on that. So, but as far as coming to this particular question, whether it can affect the heart or other, particularly like kidneys and other organs. So I mentioned it that in severely and critically ill patient, the patients can go into shock and it can go into multi-organ failure. So these will be the cases. So specifically, if I say the answer to this question is yes, it is not only the lungs. The lungs are the most common place which is the infected. The respiratory symptoms and the respiratory organs, particularly the lungs, are the main site of infection. The other any area, this COVID-19 is evolving in different ways. They can simply have a headache. The people can have shock. The people can have the heart problem. And so it can affect any organ.
Thank you very much, Dr. Ashraf. There is one question as well that about the treatment. Maybe it's too early for that, but they said also for Dr. Ashraf, Dr. Barsana, they said the ACE inhibitor was used in SARS 2003 as treatment. Will ACE and ARB will be used in COVID-19?
Shall I?
Should I respond?
Yes, sir. Yes, sir. You carry on, sir. You carry on, sir. Yes, sir.
Thank you so much. Basically, angiotensin converting enzyme inhibitor, the role of ACE inhibitors are basically in hypertension, which I know, and they are in the heart failure, which I know, and so many other, particularly in the cardiovascular system. If the COVID-19, for example, is affecting the heart and the patient is going into the heart failure, so it becomes very logical that these are the miracle drugs. These are the first line of treatment in the patients of congestive heart failure or chronic heart failure. In that case, I do not have the evidence, but as far as it is very much logical that they can be used. But as far as the current available criteria for the treatment of the COVID-19 is concerned, that most of the patients are asymptomatic, so they are not given any drug treatment. And those who are admitted to the hospital, they are given hydroxychloroquine and they are given some antiviral, and basically they are given azithromycin and some supportive care, whatever the supportive care they need, depending upon the severity of the condition. So I presently, this is my logical answer, but presently I am unaware of any present data where the ACE inhibitors can be used.
Okay, so you mean that we are treating the symptom. So if it will attack the heart, we will treat the heart. If it will attack the lungs, we will treat the lung.
Yes, because basically we are giving the main aim is supportive treatment. We are giving the supportive treatment. The supportive treatment can be in the form of fluids, can be in the form of inotropic agents, can be in the form of the ACE inhibitor. This is my opinion.
Shall I respond?
Yes, please.
Yeah. Sir, actually, leading journals, international journals have started publishing that whenever these ACE2 receptors are upregulated in a patient who now becomes COVID positive, there is chance for going more rate of mortality and morbidity. So in that case, as Professor Dr. Ashraf told, we will have to weigh the benefits as well as the risk ratio. If the patient is more sick, then we have to sort into the alternatives for controlling the hypertension. But there are more RCTs to come to support the evidence of ACE2 in ARBs in COVID-19 infection. But till now, as far as the published data are concerned, ACE2 receptors are being involved in COVID-19 attachment. So that is the present scenario, sir. We need more studies on that.
Okay. So, Doctor, since we are talking about the SARS, there is some questions about is it the same as SARS 2003? Is COVID-19 the same as SARS, since they are both coronavirus?
Certainly not, sir. This is absolutely a different virus because SARS-CoV-1, that is why they have in taxonomy, it is called as SARS-CoV-1. And now it is SARS-CoV-2 because all the surface proteins and the glycoproteins are entirely different. So now that's why there is more mortality and morbidity in COVID-19. So SARS-CoV-1 is entirely different, SARS-CoV-2 is entirely different.
Okay. Let's continue with you, Dr. Barsam. They say good immunity will prevent the infection from the body. But what they are asking, why children are less infected now?
Yes.
Since they are less immunity, but why they are less infected?
Actually, immunity means in children, the immune system is primitive. What happens in viral infection is when a virus enters, all that is being done is the cytokine storm. That's why the patient becomes more sick. You know what is meant by systemic inflammatory response syndrome, that makes the patient to go in for shock and multi-organ dysfunction. So whenever there is a viral infection in an adult, there is more development of the immune system, which will react in a faster way, which will react in an abrupt way to go in for SIRS more commonly. But if you take children, the immune system is not well developed. This is an evidence. The fact which I am talking to you is given in the international consensus by the pulmonologist, which has been published and we have uploaded in the Sures Resource platform. So people who want to read more on this can go ahead, and it is being published by all the pulmonologists from around the globe regarding why children are less affected. It is because of this reason. And to add to your point, sorry sir, sorry to interrupt you. To add, sir?
Take your time.
Yeah, because as we have seen, ACE2 receptors are more involved in the attachment for the COVID-19. Children who are not being treated with ARBs and ACE2 blockers, they will have the receptor under control. So whenever they have down regulation, the virus cannot come and attach. These are all the reasons which are abruptly seen in children.